eHealth Action Plan 2012-2020 is our guiding document that describes 4 areas of activities that we are focusing on. It's the work on interoperability, covering aspects of semantic, technical, legal and organizational interoperability. It's the funding scheme through Horizon 2020, and as the Action Plan started in 2012, it also covers Framework Programme 7 and the Competitiveness and Innovation Programme. Then it is the big part on deployment, raising awareness, collecting evidence, also involves the digital skills and digital health literacy aspects. And the 4th part, but not the least important part, is international cooperation with the World Health Organization and the 3rd countries, such as Memorandum of Understanding with United States we have on e-health, and also with other countries where we share the experience that we have gained in Europe and also learn from others. I think the challenges are many. For us, of course, it seems like there are questions about an uptake, which can be influenced by several factors. For example, lack of interoperability or lack of standards or awareness or lack of evidence to convince those who pay for these services. But also sometimes we feel that there is a lack of awareness among the healthcare providers or the patients, so that they don't know that these services exist and what benefits they can gain from these services. So there is a lot of issues that need to be equally addressed, sometimes in parallel, sometimes interrelated, sometimes one becomes more important, as in this conference, for example, the question of interoperability, but in other contexts it's the question of awareness. And then sometimes it's a question of funding. First of all, I would say that e-health is not going to replace the traditional methods of healthcare. It is not that you will have an e-doctor, because then I imagine that you also need an e-disease for that. But I think that it would be a complementary, it would add value for data sharing, for example, that people can make their appointment with the doctor using internet tools, or that they have an access to their electronic health record and they see the results of their laboratory tests, for example, or that they can consult with the doctor over the email or online tools. I think that all can add value to the existing services, save time, sometimes save money, and in the end provide for the better healthcare. And that also involves the sharing of health data, the use of the health data for research that in the end would benefit for the better health outcomes. I understood from the presentations today and from the information that we have provided that the institute is the aim of this institute is actually towards the data collection, analysis, sharing, understanding, basically trying to give the full picture of what is possible, what can be done, what has been done, so that everybody would benefit from this. I think that it is very welcomed that this institute is the result of 2 projects, and that it is not just the 3rd project, but it is an institute. So that demonstrates the sustainability of the project results in the real world. I would also say that it's a very good idea to bring together in this audience the different stakeholders in this field. The patients' representatives, the technology part, the pharmaceutical part, the healthcare providers, administrators, the public authorities. I think they all have a very important role in this process. And perhaps media could have been also present to learn, and then to learn what to highlight from this, from all these e-health discussions.